All right. So where I was kind of heading was talking through, talking through the risk factor checklist. And as you can see here, there are a variety of different risk factors, and they span across the spectrum from emotional health difficulties previously or within your family to things like your personality characteristics and traits. There are a lot of them. And so, as I was mentioning, it's really helpful to be able to, one, be aware of these, and then two, if you're able to have any support or opportunities to mitigate any of their risks, it's certainly wise to be able to work on that in addition to your gender reveal or your baby registry. Some of the things we can't change, right? We're not going to change our history, but it also might mean let's get our supports and our plans in place. And I'll talk a bit more about what that can look like. I've talked about perinatal mood or anxiety disorders. And the idea, again, is that that is any emotional health challenge that occurs during pregnancy and the postpartum period. And we really are in the midst of a mental health crisis, but it's also a mental health crisis for moms and families, which in turn creates this public health crisis, which I'll speak a bit more about. But when we're talking about prevalence, we know that as many as 1 in 5 moms will experience a PMAD. And in some populations, including moms of color, military moms, NICU moms, that number can be as many as 1 in 3 moms. We also
Dr.
know,
Garrett,
yes,
I have a question for you
yeah,
from Taylor and Leanne. She's asking, is the risk factor checklist available anywhere?
yeah. The risk factor checklist is on my website at motherhoodfeels.com, and you'll see the risk factor checklist there. Yeah, great question. The other thing I was going to mention is prevalence around dads. And oftentimes we're hearing about moms and the kind of challenges moms face, but dads are also a part of the perinatal mood and anxiety disorder population as well. So we know about 1 in 10 dads will experience a perinatal mood and anxiety disorder as well. Um, this is just a quick overview that kind of walks through some of the things I've mentioned already. Just the prevalence of around 20% of moms can experience emotional health problems, which means that we are close to 1 million moms and dads a year who are struggling. Interestingly, despite that number, we really don't have as much support as the number of people who are struggling. So that's a lot of the work I've been doing in the last 10 years or so, and I'll talk a bit more about that. This is a nice little slide for anybody who wants to take home a couple of quick facts on all this. So you know already that we have a lot of people who are struggling. We also know that PMADs, perinatal mood and anxiety disorders, are really not recognized and oftentimes undertreated, despite the fact that we have screening and screening instruments that work. And we have a population of people we can access. They are often coming into healthcare appointments. So screening should be something that is part of the kind of cadence within your healthcare, but sometimes it's not. And then we also know that there is good data on the fact that if moms are struggling, that it impacts not only mom, but the mom and baby, mom and children, mom and family relationship. If mom is struggling, that means she likely will have a hard time with school if she's in school or work if she's working. And so it does become this public health crisis. Despite all of that, we also know that there are effective treatments and that when people are treated, there are people who are able to get relief. And in turn, there is a downstream effect. So those people who are impacted on the hard side of things are also impacted on the good side of things when people are doing well. And then best practice is to utilize providers who are specialized in working in this population. I hold, and my colleagues and I hold what is called a perinatal mental health certificate. Those are certificates you can move through and find through an organization called Postpartum Support International. So if you are working in this field and you have some experience and some exposure and some interest in kind of specializing in that population, check out postpartum.net for more information on that. I'm going to walk through something, and I'll first kind of, if I could see people better, I oftentimes ask people how many people have heard of postpartum depression, and everybody raises their hand. And then I ask people how many people have heard of PMADs, perinatal mood and anxiety disorders, and like a couple of hands trickle up here or there. And so hopefully you've already learned that perinatal mood and anxiety disorders is really the better term to use. Postpartum depression certainly is a problem and it is a label, but perinatal mood and anxiety disorders is the preferred label because it really encapsulates all the different challenges that can occur. One of the challenges that is not a disorder are baby blues. And oftentimes you hear people say, oh gosh, I suffered from the baby blues, or I had the baby blues for months and months. And here's the deal, baby blues are not a disorder, it's not depression light. It actually is the typical adjustment to new parenthood. It occurs in around 80 to 85% of moms. So the vast majority of moms will experience some of these challenges, which tend to peak a couple days after having had a baby, oftentimes related to this big hormone dump that we experience. And it is often associated with like having a new baby you have to take care of, not being able to sleep all that well, having a body that's recovering from having had a massive event occur. So if the person is struggling with some of these challenges, which would be typical, what I usually tell people is that a good rule of thumb is the duration. So if you have been struggling with any of these challenges for more than 2 to 3 weeks after having had your baby, tends to shift then out of baby blues territory and goes into more of the PMAD category. So I'll talk a little bit about what those look like. So you saw in that first slide or an earlier slide, the different emotional health challenges. And I'll just mention here that all emotional health challenges from a diagnostic point of view have the same symptoms during non-pregnancy versus pregnancy or postpartum. So depression is depression, but there's another flavor to it when you are growing or taking care of a baby. And so this is what I oftentimes see when I'm working with moms. And these are little video vignettes that are pulled from my website, again, motherhoodfeels.com. So if you wanted to check those out on your own time, they're just short little descriptions of what depression and anxiety might look like in pregnancy and postpartum. But I'd say the number 1 or 2 comments I hear from people who are struggling with low mood, a lack of pleasure in doing things, and changes to things like sleep, appetite, energy, concentration, which are symptoms of depression, are things like, I just don't feel like myself, or I can't deal. This is too much. Or if I could just run away, I would just want to run away. So that obviously doesn't feel great. And when you have a baby or children in the mix, it certainly impacts the connection, the attachment, and we want to work to help people feel different than that. Oftentimes with depression, there's co-occurring anxiety, and there is often a bit of an agitation, irritability, and more of a disconnect, kind of more of an isolative piece to depression. I'd say the number 1 patient that I tend to see, though I certainly see depression, is anxiety. And anxiety, again, another little blurb on my website there, it tends to come with a lot of what if scary thoughts. And I mentioned before, some of the anxiety symptoms I experienced were things like, what if my baby doesn't wake up in the night or in the morning? Or what if she chokes? And there are a whole slew of what if scary thoughts that people can have. Oftentimes with generalized anxiety, it tends to be around health and safety of baby or people that we care about. There tends to be a lot of ruminating, so much so that it can be hard to fall asleep. Or when you're offered an opportunity to sleep, you really just can't settle down. So there's this restlessness to things. And because of that whole presentation, a lot of times moms aren't really eating or taking care of themselves. And so this might be the mom that you're kind of saying, wow, you were already back to your pre-baby weight, because it's got a bit more of an edginess to its presentation. If you have ever had a panic attack, you know it doesn't feel good. And now add in growing or taking care of a baby and dealing with what the 3 biggest fears are during perinatal panic, which are fear of dying, going crazy or losing control. And this is why we end up having lots of people report to the ED with worries that they are having a heart attack or feel like they're losing their minds. So it's really not a great situation. And oftentimes with moms with whom I work who are dealing with panic, they can really end up avoiding a lot of things that offer them pleasure for the fact that they can have these fears. So we work a lot on kind of working on exposing them to situations and getting more comfortable so they can get back into the swing of things and enjoy life. If you've heard of PTSD before, I do mention that in the perinatal period, we have, unfortunately, some different options for trauma. And it might be something around loss. I've got another slide here that walks through a lot of different examples of triggers for trauma. But with PTSD, be it for perinatal or non-perinatal PTSD, there are these 4 themes. The first is around re-experiencing symptoms. And those are things like nightmares, flashbacks, recurring memories of the trauma. The other are avoidance symptoms. So like, I don't want to think about or process thoughts or feelings about that experience. Oftentimes there's this heightened arousal level. So kind of always on edge, waiting for the next bad thing to happen. And these kind of not great emotional states, like just feeling down, low, sad, and some shame, and maybe not interested in things you usually liked. So PTSD is something that I oftentimes see in people who have dealt with some of these different challenges. That being said, you or somebody you know could have gone through some of these challenges in the past, and it did not create any PTSD symptoms, or you were able to manage the stressor without some of the symptoms. Oftentimes people forget that trauma is in the eye of the beholder. So we really want to make sure we're meeting people where they are. If they are struggling, being able to kind of be with them and offer them the support they can use. I think I heard somebody say that they were in healthcare when they logged on. And when I'm giving talks to healthcare providers, I usually give them the opportunity to recognize this awesome role that they have in caring for people who are dealing with hard things. And oftentimes, unfortunately, for healthcare providers, they can become the kind of sounding board and or a punching bag for people who are struggling. And that can often play out in kind of patients saying things like, you don't care, nobody here cared, you didn't pay attention to me. This has just been a horrible experience. I didn't feel protected here. So this becomes a really powerful point for healthcare providers to come in and work to have healthy communication, come in to share, man, this was a horrible experience for you. What can we do? Let's see if we can get some connections for you. How can I support you best? Who can and how can you feel heard? So it becomes a bit of an opportunity, though I recognize you have lots of other demands as well. I'm going to talk briefly about bipolar disorder. So for people who are familiar with this term, it's marked by 2 phases, a depressive phase, which are the depression symptoms I mentioned before, and then a high phase, which is often called mania or hypomania, which is an elevated mood state. And this tends to look like having a decreased need for sleep and still having amazing energy, taking on lots of projects, perhaps acting kind of in a way that is not characteristic of you. You might be making bad decisions, maybe spending more money, maybe kind of having a grandiose kind of thought and feel about yourself. And in some cases, you might be experiencing things like hallucinations or delusions. I mentioned bipolar because oftentimes in pregnancy, in bipolar or any other emotional health challenge, if you're prescribed psychotropic medications to help with your emotional health, some providers are less savvy and or less aware of perinatal mental health and will ask you to stop your medications altogether. And while that could be a good choice for you, it might not be. And so oftentimes in work I'm doing, I'm giving people access to research and fact sheets around psychotropic medications during pregnancy. Mothertobaby.org has fact sheets. And you can go on there and put in the medication name, and you can see a little bit about the risk benefit profile in pregnancy, breastfeeding, just so you can make a well-informed decision for yourself, because there is risk to not treating mental health challenges as well. Including, and this is with respect to bipolar, including the research here that shares about recurrence when we stop mood stabilizers and risk for more extreme emotional health challenges like psychosis, which I'll touch on in a minute. Interestingly, I find that we are working with a lot of moms who are struggling with OCD, which stands for obsessive compulsive disorder. And obsessions are defined as oftentimes intrusive or scary thoughts or images that are quite distressing to mom. And compulsions are the things that we do over and over to kind of quell our worry or fear around the obsession. And here's the hallmark of OCD, one of the hallmarks. It is that distress I mentioned. So moms feel absolutely horrified and oftentimes ashamed about these worries. And interestingly, and I'll shift to the next slide in a second, but interestingly, when we look at the themes around OCD, the number one theme in OCD is having deliberate harm come to baby or child or children. And I'll tell you a bit about what that looks like. Over here on the top right corner, you see that over or close to half of the OCD presentations are around this deliberate harm. And that would be a person who comes to talk to me who says, listen, I have really been struggling here. I really don't want to tell you about this. I don't want you to take my baby away. I don't want you to judge me. But I've been having these horrible thoughts like, what if I was walking through the kitchen and I grabbed the knife and I stabbed my baby? And I can't believe I'm telling you this out loud. This is horrible. And so that's an example of a fear. And one of the reasons that I mentioned the distress piece when I mentioned OCD was, as you could hear in that example, mom was actually ashamed and afraid of telling me about it. And that actually shows that she has some good insight, which is really different from moms who are struggling with psychosis, where they lack the insight around some of these scary things that can occur. I'll talk a little bit more about that, but I'll also mention a couple of other potential presentations of OCD, including contamination. And contamination fears can look like a mom who is perhaps breast pumping and she's washing her pump parts and it's taken up a lot of her day because she is worried that it's going to get unclean and it's going to hurt the baby. Or maybe this is a mom who is mopping the floors for hours on end for fear of her baby getting some sort of germs. And another kind of common presentation of OCD is around accidental harm. These are things like, what if I were to drop the baby? What if I'd be going up and down the stairs and I dropped the baby? I'm so worried about it that I've decided that I'm going to just scoot down the stairs on my bottom all the way down. And there's actually a book by, I think it's Karen Kleiman, who is a maternal mental health expert, called Dropping the Baby and Other Scary Thoughts, that talk about some of these different scary OCD thoughts. But here's the deal with perinatal OCD, it's not a psychiatric emergency. In fact, I work really hard to share with moms that I'm not afraid of their thoughts, because thoughts are just that. They are thoughts, not facts. And if there was a different presentation and there was not that insight there, then I would say, you know what, let's see what we can do to get you connected with more immediate support. But our support for OCD is therapy. Some people find medication to be helpful, but it's not a psychiatric emergency. And so people who are not aware of perinatal OCD really do a disservice to patients if they hear this scary thing, like, what if I'm going to grab a pair of scissors and hurt my baby? And I'm very extremely afraid of that. And so I don't want to be left alone with the baby. And they say, please never leave the baby alone with anybody like you. That is very scary to the patient. So we're working on kind of a lot of education around that. I'm going to talk a bit about psychosis. Let me show you this side first, though. So some of the other more common challenges, more common perinatal mood and anxiety disorders like depression and anxiety, Their prevalence is a lot more common. Psychosis is less common. However, it does occur. It occurs in about 1 to 2 out of 1,000 deliveries. And interestingly, it tends to have a more sudden onset. So it tends to occur in the first few weeks after having the baby. And risk factors for psychosis are having a personal or family history of bipolar or previous psychotic episodes. But another risk factor, like you mentioned before, was stopping mood stabilizers during pregnancy or postpartum period. So if you're curious what psychosis looks like, it tends to be marked by hallucinations, which are seeing or hearing or feeling things other people can't see, hear, or feel. Delusions or having kind of strange, odd, bizarre beliefs. Tends to be that people who are psychotic are not sleeping well, not eating well. There's a paranoia, a layer of kind of suspicion around things. And it can be hard to communicate because things are just disconnected a bit. When I've worked with moms who are dealing with psychosis, I've had moms who have had or who have heard voices telling them to hurt their baby. And dissimilar from OCD, they were not distressed by it. And they said, well, I heard this voice telling me to smother the baby. So that's what I did. So as you can see, there is a lack of insight and distress in that. I've worked with people with delusions who have had kind of delusional beliefs that they were living in a death state. I've had moms who I've worked with psychosis who have put aluminum foil around their windows for fear of somebody looking in or doing something. So just kind of some odd and unusual things. Now, here's the deal. Psychosis is a psychiatric emergency. And so the idea behind that is let's get you connected with care. And it is good because we can treat you quite well. Medications, support can really be a great intervention. It is a psychiatric emergency intervention and one that we do because we don't want to have risk of suicide or infanticide. Scrolling through here, another unfortunate piece of this work is working with people who've endured loss. And for a vast majority of people that we know in our lives, a lot of people experience loss. They might have experienced miscarriage, which in the US is defined as a loss before 20 weeks gestation, or a stillbirth, which is the loss of a baby after week 20. But what I explain to people is it doesn't matter if it was week 8 or 18 or 28, a loss is a loss. And so I often share with people some different resources, some books that I like, some websites that I like, and then I've mentioned Postpartum Support International. They have a number of free weekly online groups, including on topics around loss. Here are some strategies on how to get people to get connected with support.
Dr. Garrett, before you get started on that,
yeah,
there was a question about the presentation itself. This whole presentation, I know I'm recording it, but how will they have access to this?
I think I will defer to Rita on that. Rita?
Yes, so I will be sending a recap with this presentation to everyone that registered via email. For people who were able to join the call, and then we had the disruption with the power, and then for those that missed it. So yes, you will get a copy of this presentation.
Okay.
Thank you. So back to kind of being able to offer support, I would, in addition to these suggestions here, one of my biggest suggestions is to remind people that their insight is a strength. So when you're able to recognize that things are not going well, it can really behoove one to use that insight to say, all right, I'm going to see what I can do to feel better. But here is the bigger suggestion. Moms are good at taking care of people. They are really good at taking care of other people. Even when they're depressed, they tend to continue to take care of their children. So if we frame things for mom as a reminder that if you're taking care of yourself, you're going to be one, better able to take care of your baby and children, but two, model how your kids can help themselves when they are dealing with their inevitable stressors in life, it often is met with a bit more acceptance. This is a piece I often share around healthcare providers and how you can make sure you're screening for suicide. I oftentimes remind people about different crisis supports. This has been updated. It's now 988 as the mental health emergency number. I do love the crisis text line. You can text the number 741-741, or I'm sorry, text the word home to 741-741 and get connected with a volunteer for some more immediate support. But for any healthcare providers on the line, just know that asking the question about safety is not going to increase a person's risk of suicide. And there are really nice and easy ways you can do it, including things like, hey, this is a hard time and you got a lot on your plate. And it is a hard time for a lot of people. And wondering if you've been having any thoughts about hurting yourself or hurting anybody else, and being able to just inquire. If you have a person who does say, yes, I have, it's nice to be able to have some follow-up questions on hand, because sometimes it can be a little jarring if you're not used to doing that. So this is an example of that. So I'm going to switch gears here and talk a little bit about some of the supports I've created. And I mentioned the prevalence, and we know that a lot of people are struggling. And so when I first got really interested in this population, I did a lot of research and I was like, gosh, there's got to be a lot of different supports out there. And then I was really shocked to see that in the US, despite close to like 1 million people, 1 million moms needing support, that there were only about 29 at the time mental health day programs for moms. And that's in the whole country. And where I am in Florida, there was one at the time when I started my work in this, and it was virtual. And that was shocking to me. So I actually started work back after I had my daughter, and I started for the hospital system where I work a maternal mental health service line embedded within our behavioral health department. So I was meeting with people outpatient, doing individual therapy with people, and they were getting better. And I then started thinking, I think we could do more, and we could create this like really cool program. And if I could have my dream program, it would be this and this and this. And took this idea to our leadership at the hospital where I'm employed, and they went for it. And that was awesome because now we have this really great program called the Motherhood Space. And it is a day program for moms who are pregnant and up to about 2 years postpartum. And we're technically the first real wellness inspired perinatal specific day program. And there are other day programs out there, but ours is the only one that has all of these awesome perks, including no cost childcare. So we are situated in a YMCA. We're a hospital-based service, but we're connected with a really awesome, really nice state-of-the-art gym facility on the riverfront here in Jacksonville. And so our YMCA takes care of the kids who are not babies and who are mobile and would be kind of interrupting if we had them in group-based therapy. So we offer group-based therapy 3 days a week, 3 hours a day. We're covered by most insurance companies. We have scholarships for moms who utilize Medicaid. All of our days, so we're there 3 days a week for 3 hours a day. All of our days, 1 hour the day is devoted to wellness. So we'll do trauma-informed yoga for an hour, or we'll do walking therapy along our riverfront. My colleague and I are perinatal specific psychologists, and we tailor the programming every day to kind of the feedback of what's going on for moms at the time. All of it is evidence-based, so it's steeped and supported by research. Another
Dr.
wellness.
Garrett,
Yep.
is this available in any other hospitals throughout the different states, or are they looking to incorporate that? I just had someone comment that they were wondering if, or wish they had it in Seattle and
Yeah.
also in Connecticut. It's going through the chat right now.
Yeah. So what you can do is log on to postpartum.net, and you'll find a tab that lists intensive outpatient programs. I'm trying to remember what prompts to follow, but I'm probably going to tell you incorrectly. But on Postpartum Support International's website, it will give you a list of all of the different programs throughout the country that are perinatal specific. There are about 35-ish right now. If you're in California, there may be 5. If you're in the Pennsylvania area, there may be 5. Florida, maybe 2. So they're not a lot, but you can look around and see.
Okay.
But yeah, if you find the link, maybe you could share that in the chat, and I can share it as well.
What was that link as well again?
It's postpartum.net. It might be under Find Support, that tab.
Okay.
We also offer a 30-day guest pass to the Y for the time they are in the program. We have a relaxation space with a massage chair, a light box. We have a private lactation space. They have access to a wellness coach. So it's really awesome. And the thing that I really like most about it is that people get better. So I meet them their first appointment. We screen them with the Edinburgh Postnatal Depression Scale. Their scores tend to go down after, generally speaking, about 3 or 4 weeks with us. So that's pretty awesome. We also have a YouTube channel. And so this is something that is more accessible. So since you probably can't send your Seattle-based patients to Florida, you certainly can tell them about our YouTube channel. And you can like and subscribe and all that stuff. But we have a number of different videos I put together on all things pregnancy and postpartum. It looks like the ones up here are around loss, but there are a whole slew of other videos specific to the perinatal period. And the idea behind that was, I thought, well, some people are not going to come to the day program, or some people are going to have barriers to coming to the day program. Though we've really worked to try to offset those barriers. We also offer transportation too for people who need.
That's the link. Can you go back there for one more second? That's the
Yeah.
YouTube link that's there.
Yep.
I'm typing it in the chat.
Yeah, that should take you to it. You can also go to YouTube and just type in the motherhood space. This is a poster presentation we did for Postpartum Support International. It talks a little bit about the efficacy of the program and some of the overviews of the program. It also talks about my podcast that I host, which is called Hindsight is 2020, a Motherhood Feels podcast. It's on my website. It's also on Apple and Spotify. So, and it's also on our website on YouTube, and I think on our hospital-based website as well for the motherhood space. And apparently you can QR code it right here. So anyway, this particular episode is one that I'm really proud of, because it's an episode that details the origin story of the motherhood space. And then it also has kind of interviews with patients who have gone through the program. So oftentimes if we have patients who are hesitant about joining the program, they'll listen to that or kind of learn a little bit more through our YouTube channel. And our website has some information as well. So in addition to my work at the hospital, I also have created an organization called Motherhood Feels. And in it, I have my podcast, I have an online course. And the idea behind both of those was to meet people with proactivity. So in addition to your, gender reveal or your baby registry, you can log on, you can pay a low cost, less than a copay for a course that is broken down into short video vignettes, since our attention spans aren't great these days, and a handbook that you can work to personalize a plan for coping ahead of having a baby. I also have in here some features of it. You can take a look at that. It's also at motherhoodfeels.com, but also working with corporations to offer the same for employers to gift to their employees, because we actually know that parents are oftentimes employed. The number of parents in the workforce is huge. And one of my thinkings is that if we can meet people where they are, so like at healthcare appointments or their jobs, we can really do them a better service. I have also written a couple of books, and another idea behind this is working to meet people where they are. And one of my ideas was, I remember when I had my kids, I got a bunch of discharge paperwork from the hospital. I probably threw it in a bag and never saw it again, and didn't really read it. And so I thought, well, let me put something together that is attractive and that people who are busy can take in. And so I work with a lot of patients who will say, oh, I really want to read that book, but it's just been sitting on my bedside table forever. So I was like, this book has got to be short. It has got to have good content, and it has to just hit the bullet, like the bullet points here. So I created it to be rhyming, because moms might be willing to read a rhyming cadence story to their baby. And it has healthy mental health messages, mindfulness exercise, healthy mom mantras. And again, I'm working with different healthcare systems to embed that into their programming. How cool would it be to have something like this in your discharge paperwork that normalizes maternal mental health, or have this as a nice gift from your doula? So I end up selling a lot of them to healthcare providers and doulas and people like that. Can't leave out the dads, so put a book together for dads as well. Same concept, just focused on dad life, and it also has healthy dad messaging. And I'll tell you a little bit more about the dad stuff in a minute. But it has mindfulness exercise. It also has dad mantras. So again, same concept. Here is a little blurb about the podcast I have. Again, it's called Hindsight is 2020. And the idea behind it is that I interview parents on what they wish they had known ahead of becoming a parent. So I end up kind of having a chance to chat with lots of different people. The first season, I talked to people more in my community. The second season, I reached out and was talking to more experts in the field, including the executive director and CEO of Postpartum Support International. Lots of other interesting folks, like a CIA operative who dealt with postpartum depression after the birth of her twins. So lots of fun, but also really helpful, I think, content. And I mentioned the dad piece. So after working in the space predominantly with moms, at the motherhood space where I really spend the majority of my time, I'm working with moms all the time. And oftentimes they say, what about my husband? Can he come to the program? And the way we have it set up in the hospital system where I am is that it's really a mom-based program. So my colleague and I, outside of our hospital system, have put together pop-up workshops for dads. And so here in Northeast Florida, where we live, we put on workshops every couple of months or so. We partner with family-friendly breweries, and we have corporate sponsors, and we put together 1 hour of dad content. Each dad who participates gets a dad book. They get a drink of their choice at said brewery, and they get an hour of dad content that's focused on resources, support, and connection. It's really cool because I fully anticipated the dads to perhaps be a little less engaged, but quite interestingly, they are very much engaged. And our first couple of workshops we've done, we've had dads exchanging numbers and connecting, which is really neat to see. So in wrapping up, I kind of really like to remind people that, as you know, taking care of yourself is not this luxury thing. It really is a requirement. And it's cool. It's awesome to have yourself have this insight and strength. And so using that to really give yourself opportunities for support. And then the overarching thing that we hear in the work that I do at the motherhood space is time and time again, moms coming in and saying, oh my gosh, I'm just realizing that I'm not the only one, which is really a nice feeling to have when you don't feel so lonely. So the last piece that I'll mention before kind of opening up the floor to any other questions is you've heard me talk about Postpartum Support International on a lot, and I think they have a great mantra. And oftentimes I'm working to impart this on the people with whom I'm working, which is just, again, reminding them, listen, there are a ton of people who are dealing with stuff like this, and it's not your fault. And with this good help, you can get better. And that can be just really, really motivating, and offer a touch, if not more, of hope and optimism to a person who's struggling. So I will stop there. Thank you so much for listening.